Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing with your solutions to your health-related issues, lifestyle and much more. Well, viewers of COVID patients who are opting for home isolation has to keep certain things in mind. Well, there are certain do's and don'ts one should follow while taking home isolation. And question also arises, do elderly people opt for home isolation if they are detected COVID positive? So to discuss more on this, we are being joined today by Dr. Swapnav Borthakur, Consultant Internal Medicine and Critical Care and Deputy Medical Superintendent of Downtown Hospital. All right, Dr. Borthakur, welcome to Good Life, the health show. And you are here to guide us into the entire episode regarding the COVID scenario at this point in time and talking about the home isolation also. But first off, I would like to ask you that what is the COVID scenario now in the state and what is your medical team up to?
Okay. Namaskar everybody, and thank you Puja for introducing me, and I'm glad I'm presenting today in front of you in your talk show. So the first thing that you asked me about the scenario, right now I think is the second wave which is coming on. We already saw the first wave. It was slightly different from the second wave, mostly by number one, we are seeing different types of patients coming up, more moderate and severe patients. Also what we are seeing are different, in our family most of them are getting it. So, and the issues right now with the scenario is that people are still very panicky in this area about what exactly is going on, about the what they need to do, the precautions they need to take, also whether lockdown will be there, what is, where is it going to, and what are the complications. As we have seen, there are different types of complications and newer things which have come up in since we got the first phase. So those are some of the things I think which are different and have come up in today's scenario.
Absolutely, Dr. Borthakur, and lots of questions have been also emerging about the third wave. So one has to get vaccinated on time and everybody has to cover that. But a lot of shortage of vaccination news have been coming up and people are really curious what to do and what not to do. We will come to that part. But now talking about the home isolation part, doctor. Now people are opting for home isolation, one who is detected with COVID positive. Now if we talk about the youngsters who have been detected with COVID positive, they are taking up home isolation. So what are the do's and don'ts that has to be followed by the patient and also with the ones who are staying with them, isn't it?
Okay, yeah, absolutely. So the first thing that comes here is not directly going to someone who is already COVID positive and having a home isolation. What exactly is required right now is that when you have symptoms, what do? People are more apprehensive that they will get COVID. So what happens is that even it's a viral fever, it comes like a viral fever. So within a period of 1 or 2 days, some of the people will get some amount of cough symptoms which are a part of COVID, like you get cold, cough, fever which is recurring, and maybe body ache. Some are getting conjunctivitis, itching of the ears, itching of the eyes, and also anosmia, like smell is lost. So those are some of the symptoms which we can get in COVID positive patients. So the question here comes is, what do you do in the first phase? Whether you go for a test or whether you do not go for a test.
Absolutely.
So if you are having symptoms like that, first and foremost thing that needs to do is that you isolate yourselves. Because what depends later is whether you isolate yourself or not. Because you are not only the one who is getting it, also your near and dear ones who will be staying with you can contact the disease, as it's a viral disease. First thing comes is that you isolate yourself. Within the first 2 days, if your symptoms persist, you need to get a test done. Whether you do a test or whether or not, isolation is must.
Okay.
After that comes, when you get a positive report, then comes the home isolation, what we are talking about as home isolation.
Right.
So home isolation do's and don'ts is that you will be staying at home in an isolated room, which is separate, have a bathroom accessible from which is not what others will be using. So it's a separate bathroom and it's a well ventilated room which is closed up. You are going to pursue the things like mask, distance and everything for the person who cares for you. The caregiver also has to take some amount of care while giving the food or giving anything which you require. So during that period you have to maintain the proper etiquette of mask wearing, hand sanitization, and also of distance maintaining. You stay inside the room, which is a ventilated room, and stay inside. Next comes, if you are in home isolation, what do you need to do and when? Right. If your symptoms start increasing, any of the symptoms, your fever is persisting for more than 3 days, even on taking paracetamol, then, or you are having a cough which is increasing, you are not being able to sleep, your headache is increasing, or you are having newer symptoms like you are having shortness of breath. Okay. SPO is something which has been propagated everywhere. Everybody knows how to check it. So based on that also, if your SPO2 is decreasing, so those are some of the things based on which you might need to take extra care of yourself.
Absolutely.
Talk with a healthcare worker or talk with a doctor and take may require to go to a hospital. So first thing is isolation. Second is knowing the symptoms which come with COVID if you are positive. And secondly, when to take yourself to the next level, that you need care, not only a home isolation, but you also might need a hospitalization, or you have to upgrade your medications or talk with a health personnel or a doctor. So that has to be necessarily done in that stage. I think that is the basics of home isolation. Another thing you already asked about was regarding the geriatric population. Right now, with home isolation, the geriatric populations or patients with comorbidities, that means patients who are having diabetes or having hypertension, who are on immunocompromised diet. So we call them a high-risk patients.
Okay,
they
we
have
are basically talking
of
about the elderly
from mild
people
to
now.
moderate to severe in. Yes, we are going to the elderly. The youth I have already talked about. Yeah. Elderly, if it is there, the government has guidelines based on which if you are above 50, you should not opt for home isolation. I'm talking as home isolation as a total for everybody. So they should not opt for home isolation. Why? Because they go from mild to moderate and serious in very short period.
All right, doctor, I need to stop you at the moment.
As their symptoms increase.
Yes, we'll come to that. We have a caller waiting for us. Let's take the call first and then we'll proceed with the conversation.
Okay.
Hello?
Yeah, sure. No problem.
Hello?
Yeah, absolutely.
Hello?
Hello?
Ami khuni aso apnar proshno to koribo.
I asked, how can causes COVID-19 and prevention and treatment process of COVID-19 disease?
Okay, you want to know about the prevention of COVID-19 treatment?
Prevention causes and treatment of COVID-19 disease.
Okay. Doctor, did you hear the question?
Yeah, I asked question.
So, absolutely. He won the, I think he was asking about the prevention and the, about the prevention and the treatment. So first and foremost, let us talk about prevention. It has been going around that the first and foremost thing about prevention is the 3 basic things of hand hygiene. One is sanitization of your hand, keep hand washing, use a proper mask when going out or in contact with any people, and thirdly is the distance which should be maintained. That is the first and foremost. I think that has been going on from the first stage. The second thing which comes up is your immunity. People whose immunity is less are being more, having more problems with having serious or mortalities more, or they go into more moderate or serious stages. So increase your immunity. There are different aspects of how you increase your immunity. First and foremost is to have a good nutrition. Take care of yourself, regular exercises. Even if you are in home isolation, drink lots of water. I wouldn't specifically go to which type of food or what you need to take. It has been going in lots that you need to take some or another. But here I would also like to stress is that some of the things which goes in the social media, like for instance steam, as we have talked about prevention, steam inhalations. But anything which you do in more than required may also harm yourself. Like if you use steam is said to be taken for prevention, but if you take too much of steam in a higher temperature or regularly do it, they might cause other harm to your nose and nostrils. So everything in medium, so which is required, and you have to know what exactly is required and what not. So don't go through everything that comes up in your WhatsApp messages or anything like that, I would suggest. But yes, you have to increase your immunity by any means. That's the prevention. Next, second point of prevention is if you are having it, and how do you prevent your family members or near ones to get it. That I have already told you. Your caretakers or your people who are in touch with you, please stay isolated from them and do not take it as granted that you are having the viral fever. It's basically a viral fever, not COVID. Take it for granted that you might be having COVID and take care of yourself and your near ones and dear ones by prevention. That is prevention. Treatment, I think I shouldn't be telling you about treatment, because over-the-counter treatment is one of the biggest things which is causing us the problem. People know about the treatment which has been given to one person, then they start taking those medications at home, and then a mild case also might deteriorate to a moderate or severe case because you have not gone to a healthcare worker or do not contact any doctor or a 108 or anywhere, any civil hospital or anywhere nearby. So because of that, people are having more mortality and morbidity. So I suggest that you should not basically know about the basic treatment of what we are giving. What is required for you is that in the first 2 to 3 days, if you are having fever, you can take paracetamol tablets which have been prescribed, and yes, anti-allergics. Do not go anything above that. If you are having symptoms which necessitates that you take some more medications for that, then it is the time, I would suggest, to talk with a healthcare worker or your doctor or your family doctor, or go to any of your nearby civil hospitals or your health center.
Absolutely. Thank you so much, Doctor.
Yes.
Thank you so much for calling us. And as the numbers are flashed on your television screens, viewers, so if you have any queries regarding to ask on COVID and what kind of things should be done when you are at home isolation, so Dr. Swapnav Borthakur is with us. So you can ask your questions. You will be getting the probable answers at this point in time. All right, Doctor, now coming back to that topic which we're discussing on the elderly people, they should opt for home isolation or not, or what precaution should be done?
Absolutely. So as I was telling, the main idea behind giving it that above 50 should be not home isolation should not be done, or should be put up in basically a COVID care center. I wouldn't say a full ICU hospital, but at least a COVID care center, so that they are monitored better and we know if they are having any symptoms before actually they go into the stage of moderate or severe. Even if with mild symptoms, we can get them treated, and then the mortality and the morbidity as a whole of our state and in the country as a whole comes down. That is the basic thing why we need restricted home isolation in people who are above 50 and also having comorbidities.
Absolutely. Okay, Doctor, we'll continue with the conversation, but right now we have to slip into a short break, viewers, but do come back soon because we have lots more on the other side. Welcome back. You are still watching Good Life, the health show with me, Puja, and we are having a fruitful discussion on the home isolation part, whenever who opts for home isolation after getting tested positive, and what kind of do's and don'ts you have to follow. And we will be also talking about post-COVID complications as well. All right, Dr. Borthakur, coming back to you again, we have to assume things, and as the vaccination process is on these days, but there is a lot of shortage of vaccines, and so people are having sleepless nights, we can say, because they are thinking that will they be able to get the second dose if they take the first dose. Now, if we talk about the vaccination drive which is on, the time frame for Covishield has also been increased. So what about the time frame? What about the time which has been increased in between? Do the person who have already taken the first dose will have to face any problems or any complications? What would you like to suggest those people?
Now, first is that basically we will be talking about the vaccination, whether it's necessary or not. As you have already seen, people are now thronging to all the centers that they need vaccinations. Right. Well, it was started because now it has been open for all. But at some stage, we had been talking only about 60 plus, first healthcare workers, then 60 plus, and then only 45 years, and now from 18 to 45. So based on that, I think government have been going very nicely on different phases, how it has to be done. So it was in that phase also we got it. The first phase we got it very nicely, and also most of the people have got their first phase vaccinations. Then comes the second part, when it was necessary to get the second vaccinations, that the timings are increased. So right now what I would like to tell is that What has been going around is basically what has been seen. It's a new vaccine, it's coming up. We exactly do not know what is the time period the vaccine will be working, what is the longevity of the vaccine, how much antibodies will be coming up, which is the main thing which is coming up. Everybody knows, will my antibody come up, am I being, is the vaccine working for me, or is my immunity coming up? So the thing which has come up according to the guidelines and the ICMR all getting up through all the trials and tribunals that has been going through, all the healthcare workers getting it, they have shown that it can be, a first dose can be, it can be extended up to 3 months. And that is what the government is now suggesting, that after the first dose you can wait for a period of 120 days or 3 months and then get the second dose. So based on that, I would suggest people to wait nicely, that yes, when their timings will be coming, they will get their vaccines. The shortage of vaccine per se is something which will be taken up by the Indian government or the state government. It's not about what is coming and what is not going.
Absolutely.
Our issue is that will we get it? Yes, according to the what has been said by the governments, we will all be getting it. Like in the first phase, we healthcare workers got it. The people who are above 60 got it. Now, yes, on the third phase from 18 to 45, they have got the first phase vaccine. But based on the reports that we got it, it has been seen that even after a period of 120 days, if you take the second dose, your immunity does work. And based on that, I think they have suggested that the immunity is working within with the first vaccination only for the first period. So you can take the second dose later.
All right.
So I don't think you should be worried too much about why I'm not getting it only after 1 month.
All right, Doctor, we will be having a more conversation on this, but we have a caller waiting, so let's take the call first. Hello.
Hello,
Okay. Call first.
More mar bor 68 years. Teo Covishield vaccine to lower before ko bumi tendency aru hatkhonor bik hoise. Moi yar karone ki koribo lagibo?
Okay. এতিয়া চাওক যে আমি ভ্যাকচিনবোৰত কৈছিলো য'ত লৈছিলে তাতে বুজাইছিলে অলপমান জ্বৰ গাৰ বিষ বা য'ত বেজিটো দিয়ে সেইবোৰ জেগাত অলপমান পেইন হ'ব পাৰে সেই কাৰণে কিছুমান বেছিভাগৰ নহয় বুলিও নকওঁ বহুতৰ বেলেগ বেলেগ সিম্পটমস হয় কিছুমানৰ কম পৰিমাণৰ হয় কিছুমানৰ বেছি পৰিমাণৰ হয় কিন্তু হৈছে নোহোৱা সবৰে নহয় তো হেতুৰ কাৰণে আপোনাক নিশ্চয় বুজাইছিল যে প্লেইন প্যাৰাষ্টামল যেটো আছে প্যাৰাষ্টামল 650 বা 500 খাবলে দিয়ে পেইনৰ কাৰণে বা জ্বৰ উঠাৰ কাৰণে ফাৰ্স্ট 24 to 48 hours আপোনালোকে ল'ব পাৰে ভ্যাকচিন আপুনি এতিয়া কোভিশিল্ড লওক বা কোভ্যাক্সিন লওক দুইটাতে আপুনি ল'ব পাৰিব তাতকে বেছি যদি আপোনাৰ কিবা অসুবিধা আৰু হয় তেতিয়া হলে নিশ্চয় আপুনি যোনটো চেণ্টাৰৰ পৰা লৈছিলে তাৰ পৰা আপুনি পৰামৰ্শ লৈ তালে যোৱাটো উচিত
All right, thank you so much for calling at this point in time. All right, Doctor, we were talking about the vaccine and people should not worry for their second dose turn and that will come up and then they will always get a chance to take it.
Absolutely.
Now, of course, during this time gap, do they have to worry about anything?
Planning about how, yeah, sure.
Yeah, please continue.
I didn't get it, please. Puja?
Yeah, during this time gap, the gap between the first dose and the second dose, yes.
Yeah. They should not be worried. That's what I was telling. They should not be worried. It's something which is trained and under research and doing it. So you can't be strict that somebody has got it in 1 month. Why am I now being given after 3 months? It's not that it's strict that they got it 1 month. Why? So it's something which is evolving and we are knowing it much better. Medicine is something which evolves. We know from our trials and failures about what is going on, what is right and what is wrong. It's not something absolute that as we have given it, it will be done as such. It's about viral fevers also I can talk about. Smallpox has been eradicated, but chickenpox is still there. Do we question it? But when it started, so obviously we did not know what and when smallpox vaccine will come and when it can be eradicated. So this is something which in the 21st century, we are just getting it in 1 year. But think about it that we got a vaccine in 1 year and we are still waiting for how it works. So during this period, obviously we will be worried about what is going to happen to us. But everything is going on in the back in our research work where it's seen that we can also get it done in 3 months. So it's not something irrational and it's not, do not think that it's because there is short supply, everybody is increasing the duration.
All right, Doctor, now talking about the post-COVID complications, too much of news is coming up on that as well, and people are really curious to know about that.
Yes.
The near and dear ones
Yeah.
are getting reports, and they have to be again shifted to hospitals and admitted to hospitals because of a post-COVID complication. So what are these, and how one should know that you have to take a lot of care after you have got recovered from COVID?
Okay, so this is something which is new. Okay, we didn't see much of this in the first phase. We are seeing it more in the second phase, as I've talked first also. The main issue here is that I want to stress is that, again, is because you are not seeing the patients in mild patients. So what happens is that if you are not getting asymptomatic patients or symptomatic patients who are at home and do not get treatment early, can go into post-COVID symptoms. That is something I just want you to remember. So that's why we are always telling everybody to become health conscious and ask for your health checkup. Or if you have symptoms, do go to a doctor or a health center or talk with someone that I am having symptoms. Do I need to go to a health center and get my medications? Or if you are having some symptoms, do not delay in getting a test done or going to get treated for that. Now coming to the post-COVID. Yes, after 10 days of COVID, when your RT-PCR or RAT is negative, we are seeing more patients coming up with other complications. So these are complications which are mostly because of the action or the reaction of the virus which happened during the first period of your disease. But because of your immunological or immunity which you have, you sustain the attack that you sustain, you might have a RT-PCR or a RAT, that is the testing which can be negative, but the activity of the organs in your body still pursues. So because of that, the different organs, mostly lung is coming up now, but we have seen other organs of neurological and cardiac aspects also. Okay. Those different organs are being attacked by the virus, which do not show its effects on the first few days. The first few days, most of the symptoms we know, but it mostly attacks, or we get the symptoms mostly after the 10th day. So that is something right now we should be able to tackle.
So basically it is seen after the 10 days, and one should of course be very much careful when they have recovered from COVID, and also to the near and dear ones that one has to take care of. And if you need, consultations are open, isn't it, doctor? So proper consultation and consultations are very much important, because people are now not opting to go to hospitals and take necessary precautions, and what kind of precautions they can take. So at this juncture, what would you like to tell our viewers, because we are really short of time? So what are the last words you want to tell and share with our viewers?
Okay. My issue is that, yes, we are always there for consultation, whether you are in active COVID or you are post-COVID patients. Because after 10 days also, that's the period. When 7 days you are giving home isolation, you might have problems. So do not go out. The COVID is something which has to be taken up in the individual level. So it's not something which the government or somebody else, the healthcare workers, are treating. It's something which at your individual level you should take care. Take your care, take care of your near and dear ones. It will go up as a community, and absolutely will be able to cope with it in the near future.
All right, thank you so much, Dr. Swapnav Borthakur, for joining us at this point in time and sharing those wonderful numbers and wonderful things to our viewers. And I'm sure the viewers who have watched our show must be benefited with the suggestions, and also the queries which they have asked must be able to cope up with the answers they have got through. And with this, we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing again on the COVID issues, and also to the health-related issues regarding COVID. So do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.